Hi everyone, welcome back to Cast Chats. Today we're going to talk about what endometriosis is and what it is not. During my time with endometriosis, I received a lot of misinformation about the disease from a variety of doctors that I saw. I've done a lot of research and I wanted to bring some proven concrete facts about endometriosis and also to share some facts that are indeed not true about endometriosis. So let's get started. I'm going to cover 5 things with you that endometriosis is. First, I'm going to take you through the definition of endometriosis. Second, endometriosis is sensitive to estrogen and to inflammatory foods. Number 3, we're going to cover that endometriosis is extremely painful and why it is painful. Number 4, endometriosis is a disease that affects fertility. And number 5, endometriosis is a disease that can affect many different organs. Okay, so let's talk about the definition of endometriosis. The medical condition goes a little bit further, and it describes endo as the presence of tissue similar to endometrial tissue found in places outside of the uterus. So it's when some of our body cells are growing in the wrong spot. Endometrial tissue is the tissue that lines our uterus each month in preparation for a baby. There are a few theories of why this tissue, similar to endometrial tissue, will end up in other places in the body, and I'll try to do another video on that for you guys. Endometriosis tissue actually also secretes its own chemical. That chemical can further inflame the pelvis and adds to the discomfort and irritation that we can feel in our pelvic cavities. So why does this happen? Again, we don't 100% know why endometriosis tissue migrates to different areas in our body. So let's go into number 2. Like I said, endometriosis is very sensitive to estrogen and inflammatory foods. So this endometriosis tissue, just like endometrial tissue inside our uterus, it thickens throughout the month in response to hormones. So when it gets inflamed, when this tissue gets inflamed, it can cause a lot of bloating, which is why many of us will have huge bellies on us. And this bloating can press on a lot of nerves that are around the pelvic cavity, and that's why endometriosis can cause excruciating amounts of pain. If we have endometriosis tissue in our abdominal cavity, the chemical it secretes, as well as our body's natural response to inflammation, it can kind of create this fluid in our abdominal cavity that isn't normal. And this fluid is sticky, and that is what can sometimes cause adhesions or scar tissue that can sometimes bind our abdominal organs to one another. Estrogen is released in increasing amounts from days 1 through 14 of our cycle. So this might be the best time of the month for some women because the tissue is the thinnest. There are 4 specific food groups that also, when digested, can lead to inflammation. These food groups include wheat, dairy, soy, and sugar. Some women with endometriosis absolutely cut out all 4 of these food groups to minimize the spike that they might get in their inflammation, and I'll do another video on that since I have tried that diet. So number 3, endometriosis is extremely, extremely painful. When endo gets inflamed, it can press on all of the nerves in your pelvic cavity, and that's what leads to incredible amounts of pain. There are 4 stages of endometriosis, and the stage that you're in does not necessarily indicate the amount of pain you'll be in. So if you have stage 4, which is the most severe form of endometriosis, you might not have any pain, and your only indication of endometriosis might be infertility, whereas stage 1 and 2 endometriosis might have extreme amounts of pain just because of where the endometriosis is located and the proximity of where it is to nerves in the pelvic cavity. Endometriosis can lead to pain every single day of the month for many women. Number 4, endometriosis is a disease that can affect your fertility. There are 3 reasons why endometriosis can affect fertility. And number 1, endometriosis can be present in the fallopian tubes. So it can kind of act like a little barrier so the egg can't pass through the fallopian tube to, once it's fertilized, to implant in the uterus, or the sperm might not be able to get through the fallopian tube to your egg. So your fallopian tube might be blocked by the endometriosis that is present. Number 2, if a woman has endometriosis on her ovaries, the chemical that endometriosis secretes can kind of change the chemical composition of the surface of the egg, it might make it harder for the sperm to fertilize the egg. These chemicals can also be picked up by the fallopian tubes and pushed down into the uterus, and that can also change the composition of sperm and make sperm less likely to be able to fertilize an egg. So if your ovaries are clear and your fallopian tubes are good, then implantation has to occur. If the lining of the uterus is compromised with endometriosis, then implantation can be an issue. And lastly, number 5, endometriosis is a disorder that can affect many different organs. Some organs are more common to be affected than others. Most common affected organs are the abdominal cavity, the intestines, and the uterus. Endometriosis can grow on the surface of the uterus, on the outside surface of the uterus that's in your pelvic cavity, or if endometriosis is present inside the actual muscle layer of your uterus, that's called adenomyosis. Other organs that endo have been found on are the bladder, the diaphragm, the lungs, and the brain. But again, when it's found on the lungs and the diaphragm and even the brain, those are very uncommon, so I don't want to scare you, but it has been documented that endometriosis has grown in these places. So now let's talk about what endometriosis is not. It is not discriminatory, meaning that this disease does not affect women based on race or age. Endometriosis is not classified as an autoimmune disease. Our immune system is the first line of defense against any infection or allergies. So what creates an autoimmune response in our bodies when we have endometriosis is that the body recognizes this tissue as misplaced tissue that is not normal. So it's tissue that we're not supposed to have in the areas that we have it. So our bodies try to fight this tissue. Our body sends little fighter cells to try to eat up this abnormal tissue. And number 3, endometriosis is not curable. However, it is highly treatable with excision surgery by a very skilled surgeon. There's no cure because we don't know 100% where endometriosis comes from. However, a few doctors these days have trained on how to surgically cut out the disease, which is the best course of treatment. The problem with this is a lot of just regular OBGYNs are not actually excising the tissue. They're just ablating or burning the top layer of the tissue off. So you can still have deep underlying or deep infiltrating endometriosis below the top layer that they burn off. So that's why sometimes, if you have heard or if you've had many surgeries, sometimes surgery won't be effective. I want to thank you guys for following along today. I hope that this was a little bit educational for you. So if OBGYNs are telling you something that you just don't agree with or that you have a funny feeling about, or if they're trying to help treat you with a way that you don't want to be treated, then go to a different doctor or do your research. Try to look up a specialist that's in your area because so many doctors out there give misinformation and it's not fair to us. It's not fair for the patients. And so I want to encourage you to be an advocate for yourself. I know it's so hard and I know that you're in pain. And that is the worst part about this disease is that many doctors do not believe our pain. They think that hormones are helping. They think that their ablation surgery is helping, but it's not. So we need to advocate for ourselves and we need to help educate OBGYNs about what is really going on with our bodies. And a lot of information about endometriosis is just being discovered. So unfortunately, it's hard on us because a lot of that information isn't being brought to the general public yet. But hang in there, we're getting there. And that's another reason why I wanted to do these videos, was to help educate girls like me who listened to their OBGYN for so long. And here I am 6 years later, and if endometriosis was treated like it should have been from day one, I wouldn't have nearly as many issues as I have today. So thank you again for watching, and I hope you have a great day. Keep that smile on your face. Bye.